Assalamu alaikum warahmatullahi wabarakatuh. My name is Azadin Usman. I'm a resident of the UK, and I would like to thank everyone who made the time to attend this lecture today. Hopefully it's going to be beneficial. Just simple house rules. It would be great if you keep your phone on mute, and if you have any question, write it down. By the end of the lecture, we are going to have a Q&A session. So if you have any question, just write it down, and we'll be able to address them, inshallah. I've got a guest today, brother Abdulghani, who is a resident of Doha. So before I give the mic to him, I would like to give you an intro about our brother. So our brother Abdulghani was born in Karen. He grew up there. He attended primary and secondary school in Karen itself. He joined Asmara University in 1998. And like any one of us, he had to flee his country. He went to Sudan, and then he got admitted to one of the Indian universities. He did complete his Bachelor of Pharmacy in the year 2005. In 2006, he completed his Master's in Clinical Pharmacy, and since 2007, he's working at the hospital pharmacist in Qatar. So, Brother Abdulghani, welcome, and thank you for accepting our invitation. I hope everybody is going to learn from this session today, and I really appreciate you being here, making time for us. So I am so glad to hand over the mic to you, and you can start, Abdulghani.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. Thank you, Brother Azadin, for the nice introduction. First of all, I would like to thank Education First for giving me the opportunity to present my lecture. And a special thanks goes to the board members, technical staffs for arranging such useful platform. And I don't want to pass without thanking Dr. Khiyar, who is working tirelessly to bring Eritreans of different background and experts to share their experience. And today, inshallah, I'm planning to present you a lecture which will be helpful for those who are looking for a career. Title will be Career in Pharmacy, Opportunity and Challenges. Our objective will be today to enlighten pharmacists about licensing requirements in Gulf State and others, to provide information about different requirements for each specialization in the Gulf States, to discuss challenges and obstacles that face pharmacists from registration to career, to provide suggestions on how to challenge the existing obstacles. Before that, I just wanted to give introduction why I choose a pharmacy as a career or as a profession. The demand for pharmacists is strong and increasing, particularly in developed countries. Graduates in pharmacy face a greater range of career options than ever before. There is a change in the career, there is a change in options, there is a change in the opportunities also. The concept of the pharmacy professional as an active participant in the healthcare system is very exciting. It's growing tremendously. However, it should appeal to anyone with an interest in the career that it is both challenging and rewarding. So if you are looking for a job in a Gulf particularly, what are the first steps to do? I presented this slide because based on my own experience and my colleagues who plan to go into Gulf without having a complete information. So I decided to share my experience in this regard so that unnecessary efforts are reduced. Allow me to give you a highlight on this. Prerequisite for practice as hospital, community, or retail pharmacist in Gulf. Number one, academic requirement. The minimum requirement will be a bachelor's degree in a pharmacy if you are going to work as hospital pharmacist or community pharmacy. Experience needed will be minimum 2 years after completing, and the examination is a prometric exam. You need to pass a prometric exam. You have to score 60% and above. And data flow, which is not known before, it was introduced in the Gulf states since 2014. It's a primary source verification, which is done usually when a candidate go for registration in Gulf countries. And the other requirements are registration from the country of experience or home countries.
Okay, so Brother Abdulghani, I just sorry to interrupt. I just have a question with regard to the prometric exam. So you did say that if somebody has to be qualified to work at a pharmacist in the Gulf, they will have to pass the prometric exam. So my question is, my understanding is that prometric exam is being conducted, I think, in different countries in the Gulf. So if, let's say, if a brother or a sister want to go to Doha or to Oman, and they sit for the prometric exam, is that exam valid for all countries, or each country has got its own exam?
It's a good question, Azzuddin. Prometric exam is not only also limited to Gulf countries. It's a testing center. Basically, it's an American company, and it's available in multi countries. But the most important thing is every country in a Gulf has its own exam, even though there is a similarities, but it has its own exam. So if you are in India or you are in Egypt, you want to come to Oman or you want to come to Qatar, you have to mention that in the application that you are going a particular country in a Gulf, so that the exam will be limited to that country. But the company remains the same. It's the same company.
Yeah, okay. Yeah, so my other question is, and I think most people would like to know as well, regarding the registration requirement. As you know, in some countries in North Africa or elsewhere, they have two types of registration. They have the temporary registration and they have the permanent registration. So which one qualify a person to work at a pharmacist? Which type of registration?
Uh, as you said, there is a temporary registration and a permanent registration. Yeah, it's true. But usually the Gulf countries, they recognize only the experience after completing permanent internship.
Yeah.
The experience will be counted only after you complete your permanent registration. The same applies to data flow. Maybe if you have a question in data flow also.
Yeah, I think, that was my next question.
Prerequisite for practice as clinical pharmacist. I just want to give you a hint. What is a clinical pharmacist? Unlike the pharmacist, clinical pharmacists work directly with the physician, other health professionals, and the patients to ensure that medications prescribed for patients contribute to the best possible health outcome. This is available mostly in developed countries, starting from Gulf to Western, North American countries. And educational qualification for this practice, it needs minimum master in clinical pharmacy or PharmaD. This is a new pharmacy. Experience needed will be 2 years after completing the internship. Examination, the same like a normal pharmacy, prometric exam, and additionally, board pharmacy specialty certification also will add a point in this regard, especially.
Yeah.
And the other requirements will be the registration from home country or from country of residence.
Okay, so if you can help me with this, do you have to sit for a different prometric exam in order to be qualified as a clinical pharmacist, or is it the normal prometric exam?
Yeah, there is a difference in different countries. For instance, in Gulf, certain countries they have two exams: one exam for the normal pharmacist and another exam for the clinical pharmacist. Example, UAE. But in Qatar, the exam is common for both. The same exam applies for the normal pharmacist and the clinical pharmacist.
Okay. I could see there is a mention about board certification. So if you could maybe tell the audience the difference between these two, and what benefit would it give to the pharmacists if they are if they have this type of certification? In what way it could help us?
Yeah, this is not, first of all, this is not a mandatory certificate. This is conducted by an independent pharmacy agency in USA. You can say by the Pharmacy Association of USA. It's a certification that appointed clinical pharmacists to work effectively, to contribute efficiently in his specialization. Currently, the board certification is available for 12 specialties, almost.
Yeah. Thank you.
The other prerequisite for practice for pharmacists available, the industrial or teaching. The difference here is that for industrial or teaching, no specific exam is required. And the minimum for industrial will be bachelor degree, master in statistics analysis or biotechnology, something related to the industrial issues. And in teaching, the experience required maybe will be more, and the academic qualification may require sometimes PhD and with appropriate research background. So the only thing here is no specific exam to have this type of placement.
Yeah.
Next. So I have presented a slide in a question form that do all Gulf countries conduct a similar exam? Although there is a similarity in the registration process and the majority of the countries use the same test administration company known as Prometric, but UAE has 3 types of exams in different parts of United Emirates for license registration. So UAE is a small country, but it has its own uniqueness that Abu Dhabi has its own exam, Dubai has its own exam, and the Minister of Health has its own exam. And all these exams are conducted by the same company, Prometric. So one has to be conscious that when deciding to go one city in UAE, he has to have full information, because one exam may not help him to be registered in the other state of the UAE. And for example, the HAD exam, which is usually conducted by Health Authority of Abu Dhabi, it works only in Abu Dhabi and Al Ain. And the Dubai exam works only in Dubai. And the exam conducted by the Minister of Health is valid throughout the other cities, or you can say the emirates of the country.
Okay, so yeah, I think I have a question here as well. So let's say we have got a brother or a sister in North Africa, and they are qualified pharmacists and they have got experience, and they want to work in Abu Dhabi, for example. And before they go to Abu Dhabi, they want to sit for this HAD exam. Is there any way where they can have it where they are before they move to UAE, for example, instead of just going there and sitting for the exam? Are there any centers where they can have this exam before they move?
Yeah, exactly. The Prometric test center is available in multi countries.
Yeah.
The only thing is that you have to decide which exam you are going to do, and based on that, you will fill the application, and you can do the exam wherever you are. But the only thing is you need your presence is the registration process, which needed your valid residency, something like that.
Yeah.
So 2 things you can do it while you are at home.
Yeah.
In exam and the data flow.
Okay.
Data flow is simply it's document verification. Document verification. It may take time to be finished. It may take time from 6 to 8 weeks. Sometimes also more if the former employee or the people who give your experience, if they delay to reply to the authorized body in the other countries. So this will help you also if you can finish it early before you come to the new destination. So what are the other opportunities are available beyond all these requirements? What are the other options available for pharmacists? I would like to give a preview to my colleague that Canada is a good place for a pharmacist. And how is it possible to reach that? today there are a number of agencies in Gulf countries particularly, and pharmacy as a profession is one of the demanded and one it's available in the list. So as pharmacist, if he has a plan to immigrate to Canada, the requirements are very easy that he has to have a bachelor degree in a pharmacy and a minimum experience 2 to 3 years and an IELTS exam. The rest is applicable to all any other profession, but pharmacy as a profession is one of the highly demanded and one of the highly paid. So it starts the process. If you want to work as a pharmacist, you should complete the credential verification, which is conducted by the Board of Pharmacy in Canada. And there are 2 exams in Canada to be. One exam also can be done outside Canada, the evaluation exam and the qualification exam. Finally, if you complete this exam, the certificate of qualification by Board of Pharmacy of Canada will be given to you. Then in Canada, there is different provinces have the different law regarding the pharmacy. So once you will select the state, then the next is to have a sufficient hour of training in the pharmacy as student and plus internship. Then you have to write the law exam related to the states you selected, and then you will be able to be registered as a pharmacist in Canada. So the main point as option I brought here is that this is one of the easiest way if a person wants to practice as pharmacist in other country in North America. So Canada is a good option for him.
Yeah. Okay. I think if I might add on this slide, as somebody who's living in the UK and who did his Bachelor of Pharmacy in India, I remember when I came to this country, I was asking about how to register, what are the requirements. There is a process here as well in the UK. So what they need like 3 main things from a qualified pharmacist outside the UK. So first of all, you will have to authenticate your certificate. For example, I did my bachelor in India. So a bachelor in India is a bachelor in the UK, but you will have to, there is like the National Recognition Center. You just send the transcript to them and they will get it to you within 2 weeks. So once you get that transcript, you will have to apply for a higher diploma, which is called the Overseas Pharmacist Assessment Program. In short, we call it OSPAP. So that's a 1-year diploma, higher diploma, where you go to university and you attend normal classes. I think there are around 5 to 6 universities that offer that course. So you will have to apply for it like any other course here in the UK. I think the main requirement to go for that program is to have an IELTS like of 7 in each band. So in reading, writing, speaking, and listening. And once you get that, then you pay a fee and you go for that program. Once you finish that program, you will have to go for 1 year of pre-registration. It's a paid course, or it's a paid trainings. It's like an internship, but you are still like full-time employee and you get paid for that. So once you do your OSPAP and you do your pre-registration for 1 year, which is in total 2 years, you'll have to sit for the exam if you want to work as a pharmacist here. And for that, you need to reach out to the General Pharmaceutical Council in the UK, and you just pay a fee and you sit for the exam. And once you pass the exam, you are easily qualified as a pharmacist here. So the process is not that complicated, but it does require work as well.
Exactly. I think the process also looks the same everywhere.
Yeah.
So the other option is just to do the postgraduate studies. So usually we have a problem in these issues that when you are a student, you don't know which stream you are supposed to go, or which stream provides a better option. So as a matter of fact, I just want to give a highlight in this issue. For example, I have divided into 2, that the Master of Pharmacy Practice or Master of Clinical Pharmacy, and the other side is postgraduate studies in biotechnology, bioinformatics, clinical pharmacology, and the pharmacometric, which is mostly applied on the industry side. So our colleagues usually in South Asia, they go after pharmacy, after bachelor in pharmacy, they go for master in biotechnology, master in pharmacology, something. Then they go for hospital career when they go back home or they come to the Middle East. So in Middle East, this will not be credited as a master in you can say that in healthcare. They will credit as if it is done as in science. So one has to be careful enough that before he selects a certain field that he's going to this direction, so he should look or develop this section in a better way. So for instance now, the postgraduate studies, especially the biotechnology, bioinformatics, clinical pharmacology, even you have a better opportunity for scholarship in the West. The Western universities, they provide huge support in the research, especially the life science. And then what will happen is the opportunity of placement in the multinational pharma companies also is a big. And the third is that no complication when moving from one country to other, because there is no issue of requirements of exam, requirements of registration body and something. You are an analyst, you are a production expert, so just you will move from one company to another company. The other thing is the Master of Clinical or Pharmacy Practice is almost the availability of scholarship is rare. It's self-paid studies. And there is a disparity in the practice from country to country. And usually it is complicated by various requirements of developed countries versus less developed countries. Because when you come to hospital setting, you cannot compare the hospital settings that are available in the West, which is with the one that's available in sub-Saharan Africa or South India, South Asia, I mean. So just to give a brief light, that if you are going to postgrad in biotechnology, bioinformatics, that you should know that you are going miles away from the hospital career.
Yeah.
Next.
Yeah.
So here, what different practices are existing today than the previous period? In old, pharmacists were educated with an emphasis on preparing and dispensing medicine, and this has remained the wide perspective of the public sticks in this issue. But today, pharmacists have moved to a direct patient care that optimize the use of medication, promote health, wellness, and disease prevention. So now the issue is that, for example, in a country that we know more, in India, after 2007, all the colleges that were providing, or majority of the colleges providing bachelor studies, they moved on to a pharmacy. It's a 6-year course. So the goal of the pharmacy is mostly to design it to give students, to introduce students with more clinical syllabus, which will help him to provide in a multidisciplinary team in a hospital or in a healthcare system. Thank you. Next. So I would like to present here a scenario which may be helpful for our colleagues who are studying or nearby to graduates. That this is an article in Indian Journal of Pharmaceutical Education, emerging job opportunities for pharmacy graduates and looking outside the box. The aim of the present report was to find the potential employment opportunity for pharmacy graduates and the scope for development in each specific area. So there are challenges, even though India succeeded in moving from a bachelor of pharmacy to pharmacy, but there are real challenges in the ground that cannot be missed. So what are the challenges? Unlike in Europe and the United States, the role of the clinical pharmacist is less defined in India. The field of the pharmacy practice and the clinical pharmacy in its initial stage of development. So this issue, this challenge is not only limited to one country. It's almost it represents the whole area, or it represents also, we can say, if you compare the sub-Saharan African countries, even India as a country, it has progressed a lot in the industrial sector, but it's lagging behind in the hospital sector. So at least it has one area strong in it, the other area is missing. The other challenge is pharmacists with PharmD are facing difficulty in getting placement as a clinical pharmacist in hospital or clinical setting. This is, as I mentioned, that the clinical setting is lagging behind. So there are reports that poor satisfaction among the pharmacists working in different pharmacy sectors. And many PharmD graduates are unaware about the non-traditional career opportunities in the job market. Because most of students, they are simply part of the conversion that took place by the regulatory body in India, but they are not aware about what are the advantages moving from one to another. And there are real factors that we want to share as the data here is, for example, 60% of the pharmacy graduates in India, over 60% they join industry. While in UK, only around 4% only join industry. In India, less than 3% join hospital pharmacy, while around 50% in UK, they join community pharmacy. So the disparity in practice, it makes a challenge also for a candidate in a pharmacy who's looking at a job, who want to move from one place to another place. I would like to share you also a comparison here between three regions. For example, USA, it has a well-established healthcare setup, developed clinically oriented curriculum since decades, and they continuously update curriculum and make periodic revision. For instance, in USA, this started since 1956, and you can say that it's one of the advanced in this in the clinical pharmacy, one of the advanced states. Whereas Middle East, particularly Gulf, they have well established healthcare setup and consultation, the guidance from developed nations is in place. Even though the clinical pharmacy is new, but it is established based on consultation, the guidance from developed nations. So it has grown tremendously in a short period. And the other advantage, they have qualified multicultural medical and teaching staffs. Whereas the South Asian countries, they have deficiency in the hospital-based setting for clinical pharmacy role, and mostly they face criticism in terms of program design and the content of the curriculum. And the other issue is also inadequate trained staff. So this, when I say South Asia, at least we have to keep in mind that these countries are better than other many countries in the other part of the world. But still, the concept of the clinical pharmacy is lagging behind the US standard or the Gulf standard. So they have presented an option for pharmacy graduates. This is related to an Indian graduates. For instance, the pharmacovigilance. Because the issue is that working as clinical pharmacists or as hospital pharmacists in the mentioned countries, the satisfaction is not meets the expectation of the candidate. So there are other sectors that can provide a better option of salary and the same thing, good satisfaction, and in terms of the job specification also, it is the specification of the pharmacy, because pharmacovigilance about quality control, about clinical trials, about the post-market surveillance, all this one scope is part of the pharmacy. So nowadays, many multinational companies based on the Western, North American, they do the pharmacovigilance in collaboration with some IT companies based in India. And formerly, they were hiring physicians in this scope. So now it became an alternative for pharmacy to play a role in this issue. So this is one of the good alternative to seek a better placement than the poorly paid hospital career. The other option is the academy. The pharmacy now as a new stream. Uh, Many countries they have a shortage in the qualification, particular to pharmacy. So we see many countries, particularly in Africa and some Arab countries, the staffs usually the Indians are the majority of the particularly in Africa. I've seen that many staffs from India and Ethiopia in the newly emerging pharma colleges in Ethiopia. And the other is the clinical research. The South Asian countries, they have well-established hospital, well-established industry. So particularly the clinical researches, they pay more than the hospital careers. So in the pharmacy, they can play a great role in these issues. The other last options are medical writing and the medical advisor. This is related to the scientific articles, revising scientific articles, arranging the product usage guidelines, regulatory issues. So, and this is all uh, all is this is mostly required in big multinational companies. So certainly the payments are far better than the current hospital payments.
Yeah.
Next.
Yeah. So yeah, before we move next, I just for all those brothers and sisters who have like a pharmacy degree and they would like to land a job somewhere in the Middle East. What do you think? What the scope is? Are there any job prospects in terms of them finding a job that they want for pharmacy graduates?
Yeah, of course there is a job always, but the thing is that the competition is high. So to make you a better candidate, you should make a specialization that after completing your pharmacy, you should look for certification. Pharmacy is like IT nowadays. There are a number of certification, which is usually provided by the Board of Pharmacy Specialists of USA. So this specialization will help you to enhance your confidence, to improve your competency, to increase your therapeutic knowledge, to make you a better person or a better candidate for the placement. So completing your degree or doing your pharmacy from the college alone will not be enough to be a better candidate for the.
Yeah. So yeah, are you saying that pharmacists should have this, this IT people mindset? I remember when I was in India studying pharmacy, I never thought of board exams or getting like a certification. It was always my friends who are doing IT who used to go for American certificate. They used to have like this online certificate with Microsoft, and then they end up like landing a good job with a better pay. And I think we as pharmacists, I'm just talking from my my generation, we never thought of going for board certification. So maybe do you think if we embrace that mindset where pharmacists need to open about their profession and maybe go for board examination and that kind of thing, do you think that would help in some way?
Exactly. That's where we are looking for, and the market also needs that. So the same, is there any certification that make you a better candidate for hospital career? Yes. So this is what you have said, the board exam, I mean. Nowadays, the board of pharmacy specialists, they provide certification in 12 specialties. In 12 specialties, from pediatric to cardiology, to critical care, to geriatric pharmacy. really, Brother Zadine, this type of certification, it reshapes your understanding of the pharmacy scope. It makes you well oriented in your in your specialty. It makes you a better candidate. And once you prepare yourself for this type of exams, wherever you plan to go to Abu Dhabi, you want to go to Canada to write the exam in UK, it will make you a competent person everywhere.
Yeah. And what are the requirements for somebody to go for those type of certification?
The requirement is it's only needs a degree in a pharmacy. Even no, there is no says that a postgraduate studies. It's an open exam. You can say the minimum requirement is a degree and 3 years experience. Previously, it was even open for the new graduates, but nowadays, minimum 3 years experience is needed to write this type of exams.
And this is something you could do while you are like in your full-time job, right? It doesn't really, you don't have to spend like 8 hours a day studying for board exam. You can still lead your normal life and go for that certification.
Yeah, this is self-paced exam, or you can say self-paced study. And maybe how I can prepare for such exams. I would like to share with my colleague that this is not the only books, but I selected. For example, the NAPLEX exam. This is basically the North American exam for registration. But in Middle East, one of the countries use this exam, which is the HUD exam, Health Authority of Abu Dhabi. Their exam is equivalent to the NAPLEX exam, or it's similar to NAPLEX exam. So we can say that the Abu Dhabi exam is the most tough exam in the Middle East. When you are preparing for that exam, you should use the NAPLEX book to prepare yourself. Another book is the pharmacotherapy. Pharmacotherapy is this book is prepared by the board of the Pharmacy Association. This is helpful only for when you want to be board certified in pharmacotherapy. So this is also related to the board specialty, which is pharmacotherapy. And this is the first exam to be done for anyone who want to go to the board certification. It's not a must, but this is the first one to open your mind. The other book which I put is Clinical Pharmacotherapeutics. Also, this is one of the good references if anyone who wants to develop his understanding of the hospital and the understanding of the clinical pharmacy and therapeutic. It's just as I shared as a useful link, because nowadays there are huge resources online for anyone who wants to continuously update himself and to be dedicated to continuous education. So this is a UK website, UK online resource, Future Learn. They provide very useful links sometimes related to pharmacy, and this is one of the antimicrobial stewardship for Gulf, Middle East, and North Africa. I'm not saying this is the only one, but I'm just giving highlight. There are many like this, which anyone can access it freely at any time. It's self-paced learning. I shared also as top 3 online learning resources the following, but they are not the only one. There are many, but anyone who wants to develop his career, wanted to keep on continuously learning, this is one of the useful websites.
I think, yeah. Well, thank you, brother. I think now I would say we are okay to receive questions from the audience. If anyone want to ask question, Abdulghani is here. I mean, we'll be here to answer your questions. So just go ahead and you can, if you don't want to speak, you can write down your question in the chat room and we'll be able to answer it. So maybe to start, Abdulghani, until our brothers come up with questions. So what piece of advice would you give to to our brothers and sisters who are now completing their high school and they chose pharmacy as a career, what piece of advice would you give? How do you think they should view pharmacy and how they want to lead their future? So if there's anything you would like to say to them?
Yes, exactly. It's a good question. The first point I want to say is that anyone who's going to the pharmacy now, there are two options still running as a choice: the Bachelor of Pharmacy and the PharmD. So anyone should know that if he's going to Bachelor of Pharmacy, the option available for him is to do postgraduate in like industrial school, because the expectation in the coming few years is that the minimum requirement to work as a hospital pharmacist, it might be changed nearby time, that the minimum might be the PharmD,
Yeah.
practice as pharmacist, as healthcare provider, I mean. But if you are going now, for example, Bachelor of Pharmacy, you have to keep in mind that this option you may miss it. So that keep in mind that only the industrial option is remaining. So one have to be careful when selecting. If you want to work as a hospital pharmacist and now newly joining the university, that I advise him that he has to go to a PharmD option. This
yeah. Thank you. I think that answers my question. So I think we have Muhammad Abdullah who raised his hand. So I'm going to unmute you if you can.
Yeah, assalamu alaikum.
Alaikum salam.
Good evening, everyone. My name is Muhammad Abdulqadir Kekia. I'm a sixth year or final year student, PharmD student in India, Bangalore. So first of all, I just want to start by expressing my gratitude to Dr. Abdulghani for the, mashallah, very wonderful and informative presentation. Thank you very much for that. And I want to thank the presenter, mashallah, brother Azzuddin. Thank you so much for such a wonderful way of leading the presentation. My questions are like, I have three questions. So basically, PharmD graduates who are going to write the board pharmacist specialist exam, which is provided by the American Society of Healthcare Pharmacists, is the internship year counted along with the 3 years? That's the first question. And the second question would be, keeping in mind the fact that you are in the Gulf and you are already in the market, as they say, you are more aware of like what are the areas or the fields of the pharmacy practice in terms of it being like industrial pharmacy or clinical pharmacy or biotechnology. Which areas are looking more promising and have the highest rates of employment? And the third question will be, as you all know, like most of us are Eritreans, and I carry an Eritrean passport. So regarding the registration in a pharmacy council, is a pharmacist that is registered in a pharmacy council that is not of his own country, like let's say, for example, I get registered in the Indian Pharmacy Council, is that considered as a valid, I mean, what you call it, paper that you can go and like submit to the authorities in whatever country that you are applying in the Gulf? I hope you understood my questions.
Thank you.
Thank you, Brother Muhammad Abdullah. It's a very clear question and very important as well. I would start with the first one regarding the board certification exam that I said that minimum they need 3 years. If I'm not sure, but I would like to tell you one thing. The board exam in the beginning, it was open for anyone. So the internship most likely will be counted. There is no an option for this. There is no, it's not a registration. The board is just an extra qualification that help an individual. They are not authorized to give registration or something. The other question that you have asked me is about the job opportunities in Gulf particularly. Is it clinical or industrial? To tell you, in Gulf, the industrial sector is not as much as the West. So the trend is going on is mostly the hospital side. The hospital side, particularly the clinical pharmacists, the board certified pharmacists, usually they are highly paid, and you cannot compare it with the industrial options that's available. The industrial only will be helpful in the West, particularly when you go for research. The Western universities usually they invest huge money in the research, particularly the biotechnology. As you know now, the biotechnology drugs are now the trend of 21st century. So in no way, when you are thinking of Gulf, just know it is a hospital. So the specialty that exists in the board certification, the 12 specialists, you just select one of them and go on. The third question, I think I forgot it. If you can remind me, Azadin.
I think it was something about
registration. I remember.
Yeah.
There is no an issue with that. Even me, I had only the Indian registration, so it's not a must that home country. It means that the home that the passport that you are carrying. No, this is just a registration where you started your. We can say that if India give you that registration, it's valid everywhere. No issue with that.
Yeah, I think, if I might add to this identity, like when you have like an Eritrean passport, I remember when I came here, when I was authenticating my certificates, I think it's about naming. I remember I had like Ism Rubai in my certificate back in India. Then when I came to the UK, I decided to use just my name and my father name. So, and then I came to learn that they don't really care about the identity. I think for most people who graduate in India, they don't normally write identity on the certificate. They don't write your country and where you're from. So for all, I mean, I think there are a few people who normally worry when they come to the West that they have a case with the government, and then they want to continue, studying higher studies, and they worry about their identity. I think here where I am now, they don't really care about you, whether you apply as Sudanese or Eritrean. As far as that person is you, and they can verify that with the university back, then it doesn't really matter. So if you are if you are a graduate and you happen to be in the UK, for example, and you want to be registered as a pharmacist, and let's say you studied in India as Sudanese, as an example, I'm just giving an example. It doesn't mess with your case or whatever it is. They just want to verify that are you the person who claim to be like a pharmacist here? If yes, then that's it. You could get your certification. Any other question? I think Muhammad, did you raise your hand again, or?
Yeah, I have raised my hand again. Yeah, I just want to add one more question, please. First, thank you for answering the first three questions. One more thing is, as you all know, most of us, one of our aims, one of our goals when we chose to go for the pharmacy field is a good pay that we will expect like after finishing off our course. So how the pay scale looks like in the Gulf countries in terms of working as a clinical pharmacist or working as a community pharmacist? And thank you.
Abdulghani, would you be able to answer that? Because
frankly speaking, Muhammad Abdullah, although it is a good question, but just when you go to online, you search for this issue, in the Gulf, the image is not clear. It depends upon your luck. When you are working in a big establishment, it's different. When you work in a small establishment, it's different. But when you go to the Western countries, for example, when you say the UK or USA, it's very clear. The clinical pharmacist is this, and the community is this, and the nursing skilled units is this. But in the Middle East, it's very different. But one thing just to make for you sure is that the clinical pharmacist with PharmaD and the board certified, they have a good future in the Middle East or everywhere. So the only thing is just Muhammad Abdullah, you have to focus is what is lacking in India. You have to make it by your effort. You have to add up from the other resource. That's very important, and you have to focus in this time, in this issue, inshallah. The other things is left for the luck, inshallah. I wish you a better future.
Yeah, I think we have a brother Azmi, AZMY, who raised his hand or her hand. If you could go ahead.
Assalamu alaikum. Good evening, guys.
Alaikum salam.
So first and foremost, thank you guys. Thank you so much for arranging this kind of meeting. Really helpful for us because we are like fresh graduates. So for me, I'm Azmi Idris. I'm studying in Hyderabad. I'm a pharmacy graduate. This year I've graduated. So my question is, some institutes are offering such kind of courses which is like pharmacovigilance and clinical trial and clinical data management, and thus are you familiar with that and what you advise about it, about that kind of courses? So they are offering this course for 6 months only, and including like internship in industry field. They will give you like a certificate, experiment, and all this stuff. So what do you think about this kind of course? Is it valuable for us? Or?
Well, I think I can answer that question. I mean, I did my pharmacy in India, but now I work in a clinical research company. So I work as a project manager, a clinical project manager. So I don't work behind the counter anymore. I think that question is quite subjective. It depends on what you want as a person. Do you really want to work in hospital pharmacy? Are you more into an interactive person who want to work in a company? The courses that you mentioned are very, very helpful. But if you want to go to the industry side, so you will have to ask yourself: do you want to go? What do you want to do? Like after now you have graduated, do you want to work at a pharmacist? If you want to work at a pharmacy, then I think Abdulghani had already explained you need to do some sort of examination, experience. If you want to go to the industry side, the scope is very high. Where I am at the moment in the UK, I think most of the pharmacists that I know work in industries. I think it really depends on the person, to be honest. So the scope is high. The job, I think, I don't know how it is in the Gulf, but in Africa, but in Europe, if the clinical trial environment is quite lucrative, and you could easily land a job here. So that's a question that you should answer by yourself. To be honest, it's not like right or wrong. It's just what you want. If you want to go the industry, go for those courses. If you want to be a qualified pharmacist, then just go for the certification and for the exams.
Okay. And what is the minimum qualification to be like a clinical research associate or clinical data management? What is the minimum requirement?
So that depends on the company where you are applying. Some companies would require a minimum of a degree either in pharmacy or biochemistry or biotechnology. You will have, when you apply for a job, you'll have to look for the job description, and they normally put this kind of questions there. So they will tell you, we need a person who has a science background. Obviously, if you're going to work in a clinical trial environment, you are required at some level, to have an understanding about clinical phases. So they will put the requirement there, and I think they would need experience as well. It depends on the role that you're applying for. If you're applying for an associate level, they don't require any experience from you. If you are applying for a senior level, then you need to have some sort of experience. So they don't really, you don't need to be having like experience with working in hospitals if you're going to apply with a clinical trial company. You just need to have a good understanding of the science behind clinical trials, and then just look through the job description and go for it.
So is like there is more opportunity in Europe more than a Gulf country regarding to this kind of course?
Oh, I can speak for Europe. Yes, there are a lot of opportunities for. I mean, the clinical trial industry is very big here, and I think if I'm not wrong, 8% of UK income is from pharmaceutical companies that work with clinical trials. But I don't think this is a huge field back in the Middle East, in Africa. But I mean, Abdulghani, if you want to add to this, you're welcome.
Yeah, honestly speaking, what Brother Azmi asked is a very good question, because we all are from the same country that we got our degree. And this confusion have been in a place since, I can say now, 30 years almost.
Yeah.
So, Brother Azmi, you told that you mentioned about the 6 months course regarding the clinical trials. Basically,
Yes.
this type is very good. But one thing I'll tell you, Azmi, this is clearly the industrial side. So the goal of this lecture is also to avoid that the confusion that exists among the new graduates. The thing is, Azmi, when you are in India, I advise from my point of view, after finishing Bachelor of Pharmacy, I recommend you, if you are interested in such things, I recommend you to do IELTS exam. You score good, or if possible also GRE, because some universities in the Western, for postgraduate studies in biotechnology, genetic studies, or clinical trials, they may ask you GRE, but you can serve it by your own. What are the requirements? So I advise you that there are huge resources which is applicable for the countries, underdeveloped countries, country below Sahara, and you can apply for purely scholarship, and you move to that country where there is a huge option to work as a clinical trial in multinational companies, because these countries, they invest a lot in research. But once you complete in India, this graduate, you'll come back where? You'll come back home, where we know. You'll come back to the Middle East. Also, they might ask you a huge years of experience, uh, more years of experience, which might not be available with, most likely, with our people. So you may miss your way, I can say, because finally you will come back to work with your own degree. So it is counted, because the years that you spent to do the postgraduate study in India, it may not help you. So finally, you may not use it. You will come back to work with your degree. So from the start, prepare properly, and try to do it in Western countries.
Anyone want to ask question? If you don't want to speak, you can write your question. Brother Muhammad, go ahead.
Hello, yeah. Am I audible?
Yeah.
Yeah, okay. So my question is again for Dr. Abdulghani. So for those who graduated from India, for achieving those that requirement that most of the Gulf countries ask for, which is 2 years of experience, where do you advise people to go? Like I heard some people, they advise to go to Egypt to get that 2 years of experience, or maybe Sudan. So what are your advices on this point?
Thank you, Brother Abdullah. It's a good question, but this remains optional, because it depends upon the person preference. Maybe for someone it's easier in Sudan, for others it could be easier in Egypt. But as far as I know, Sudan is always easier in terms of registration. But I don't have a sound information about Egypt and the other places. So 2 years experience in hospital to work as a pharmacist in a Gulf. Many people, they do this experience in Sudan. For instance, brother asked about the industrial scope no, no, he asked about industrial studies. For example, many people, they do postgraduate in India, pharmaceuticals, or analysis, or and they go back to Sudan, for example. But finally, they end up working as hospital pharmacists, and they complete 2 years or 3 years. When they come to the Gulf, nobody recognizes the pharmaceutical certificate, the biotechnology postgraduate studies, because this completely is considered as a science, and not only in the Gulf, in many other countries. So the only thing I can advise is just anyone who want to work as, after completing Bachelor of Pharmacy, want to work in a hospital or in a retail pharmacy, you have to look to the easiest way where he can register and start to practice least to have minimum years of experience, 2 years experience before going to a Gulf country. And still in a Gulf country, also one who don't have experience, also it's possible. You can apply for training also in a Gulf country, but one who may not have a family in a Gulf country, it may not be easy as you know it, because the cost of living is high to wait 2 years jobless doing training. So I finally advise where it is easy for you, you can go.
Thank you. Is there any other question? You can always type your question if you don't want to speak. So,
Brother
Abdulghani,
Azadin,
yeah,
Brother Azadin, one he wrote in the message, can I have training in India itself? Uh, and this is good question. As we mentioned in the slide, that training after completing your registration, license registration is the only one that is counted. When they asked you for minimum 2 years, they don't count the months or the years you spent before completing your registration. And nowadays, there is a company that verify all, starting from your document, educational certificates, into your experience certificates. So wherever you do, it is valid. But the only thing it should be, there should not be a counterfeit. Yeah, the company will come to the place where you claim that you have spent 2 years experience. So if the company is not writing the same thing that you mentioned, you provided, uh, it might be a problem. So just ask yourself a question: is it eligible for you? Is it possible for you to spend 2 years after graduation in the same country that you mentioned, so that to have a valid experience? So I don't think it will be easy. I don't think it will be easy. And finally, also, the don't forget that data flow is, even though it's a multinational company, but it exists in India with a huge number of employees. They go every corner you mentioned in your updated CV, they verify it. So I advise colleague, if there is another option to look into it, that will be better.
Yes. So, yeah, if I may add a little bit, like, with most of us who studied either in the Middle East or India, when I remember that so many brothers, when those who migrate to Europe, when they come to Europe, most of people find it so hard to pass IELTS. It's because they don't have the time to prepare for it. So the only recommendation I would give to the new graduates or the people already in studies, while you do your uni studies, try to prepare for IELTS. Just go and sit for the exam and try how you perform there. Because having IELTS is not about your level of English, is about techniques. So I think I would recommend you to try and just take advantage of the time that you have there, and just go for IELTS exams, just have the certificate. So once you graduate, then you're ready to go from that place, because that's an international accepted certificate. You'll be able to either apply for a job or go for higher education. Even if I remember here when I decided to do my master's, I was asked to sit for an IELTS exam, and I had to do that. So if I did it when I was back in Sudan, I wouldn't waste 5 weeks of my time preparing for it and paying more than $200 for the exam. So I would highly recommend brothers who are still at uni to just spend some more time in getting those type of certificates, because they are going to help you a lot when you apply for a job or when you go for higher education. All right. So is there any other question you guys would like to ask? Anyone? Abdulghani, do you have anything to ask? One last bit. Okay, so until we get questions from the audience, brother Abdulghani, I just want to ask you, there are so many of our brothers who actually go to the Gulf, then they start looking for a job. What would you say, to the new brothers who are still at uni, and do you think it would be best for them to do their own research before they travel, and then maybe apply for jobs where they are before they start moving? Do you have any advice for for people who are actually graduating now and they want to look for a job elsewhere?
Particularly the one you asked in the Gulf, that one I can answer. So I think we mentioned that to use our time effectively and to save many of our efforts. So I recommend that everybody, after having 2 years of experience in home registration, after home registration, to apply for data flow before he come to the new planned destination. This will help him to save time and money. And if there is anything you want to add, also the data flow, they will communicate with him by email wherever available. And for example, this is possible. You can apply it from Sudan, for example, when you are doing your when you are working, for example. The second option is that the second thing I want to advise is that for preparing for the exams, prometric exams. The same things also, the resources are available now everywhere online, and we can share also for interested individuals. We have it. Many of our friends also they have it. So I advise people to prepare themselves for the exam, and they can do it wherever. For example, I don't think it's available in Sudan, but it's available in Egypt. Sometimes also, as soon as he arrives the country he plans, he can do the exam the next 2 days, for example, if he already planned it and completed preparation. I mean, so these things will help. So the only thing is that you should have 2 years experience, prometric exam, data flow completed. Then the rest is for the luck, I can say.
Yeah.
And the other option can come also later. For example, you might not be satisfied. You may not be satisfied with your current position, with your current work in the Gulf countries. But as I said, there is an option also if you want to immigrate, also skilled immigration. There is a big chance to the pharmacists other than the other scopes, especially the healthcare journal, the healthcare professionals. This also is not necessarily that you should pass the pharmacy exam. If you want to plan to New Zealand, you want to plan to go to Canada, it's not necessarily to pass the pharmacy exam right away so that to apply. No, the most issue is that you should have bachelor's degree and a good score in IELTS. You can apply. The rest is up to you. If you want to work as a pharmacist there, you have to pass the exam, which is available for the pharmacist. If you want to change your career, it's up to you. So, but the option that you have because of having degree in pharmacy, the option of the opportunity of immigration that you have, it may not be available for the others. So just to think in this way. So this is what I can say after. Zadine, you can add also if you have it.
I think you have said it all, to be honest. And I just want to take this opportunity to thank you for your time. And I find the presentation very, very helpful. I did learn a lot from it, to be honest. And I hope and wish that the audience had benefited from it as well. Just one last thing, I think, before we close. Yeah. So, Brother Abdulaziz, hopefully, I think you have a question. So I'm gonna mute you if you want to ask. I thought of sealing this meeting, but if people are raising hands, then why not?
Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam.
Yeah, I'm doing pharmacy in Bangalore. So first of all, I have to thank Dr. Abdullah and Azadin for this good presentation. I also thank you for giving me this chance to ask you a question. So my question is, the registration is available regarding pharmacy in Sudan is only for bachelor and master. What do you think for those that are graduated as a family? You got my question?
Yeah.
Yes. Brother Abdulaziz, I just want to confirm for you that the registration that's required from the home country is not must required as clinical pharmacist or as a regulatory pharmacist or as hospital pharmacist. It is just a registration as a pharmacist. Whatever you are, a pharmacy, a clinical pharmacist, and Bachelor of Pharmacy, everyone writes the same exam. And keep in mind that still the Middle Eastern countries, not all of them, they have a different exam. For instance, in Qatar, the exam attended by the clinical pharmacist and the exam attended by Bachelor of Pharmacy is the same. So the exam is just a regulatory issue. It's not have with your own practice. So don't worry about that. Just register yourself as pharmacist. That's enough. But as I mentioned before, some countries like UAE, the exam for the clinical pharmacist is different than the normal pharmacist. But these things don't expect it, especially in African countries, because still even the scope of the pharmacy is not available as a course. It may come in the coming years, but still so far there is no pharmacy course. So I hope I answered your question. Don't worry about that. The only thing is you have to prepare yourself in a better way when you plan to come to Middle East, because keep in mind there are thousands of candidates. They come from all over the world, and you keep in mind that nowadays the Middle East is open to many. Now it's more easy to enter Middle East than before, so the competition is more. So based on that, you have to prepare yourself to be a better candidate for the better placement. I hope I answered the question.
Yeah,
Abdulaziz, does that answer your question?
yeah. Thank you so much.
Sure. Okay, so I think Brother Abdul Qadir wanted to ask a question.
Yeah, I'm Abdul Qadir. I graduated pharmacy practice master. First and foremost, I would like to thank you, Dr. Abdulghani, for illustration as so many doubters, as well as Brother Izzeddin Usman. So I have two questions. The first one is, what is your advice whether to do experience after completion of bachelor or to continue for higher education? And the second one is, majority of the candidates are asking us after completion their bachelor of pharmacy, which courses can I do? Whether okay, which one is better for me? So could you give us a little advice regarding this? And thank you.
It's a good question, Brother Abdul Qadir. First of all, I congratulate you in completion of your Master of Pharmacy practice, and I wish you, inshallah, a bright future. Coming back to your question, regarding the postgraduate studies after completing Bachelor of Pharmacy, it's really a debating, because we know that in India or most underdeveloped countries,
Abdulghani, إذا رفعت صوتك يكون أحسن شوية.
As we know that the emphasis in Indian curriculum or any countries that comes under developed country, the emphasis in the preparation and dispensing, the whole curriculum that you study is not much related to what is in the current scenario of practicing as a hospital pharmacist or as a clinical pharmacist in a Gulf, particularly in a well-established hospitals. So based on this background, I advise particularly those who are completing Bachelor of Pharmacy, if they plan to work as hospital pharmacist or community pharmacist, I advise them to straight away go back for experience, to look for experience, 2 years experience after completing their registration, and to join the career life. And those who are planning to do postgraduate, I advise the same issue, that doing postgraduate now it has been more easier than before, because the scholarships that's available now for life science in the Western world is huge. If you can surf it, you see it. So doing postgraduate in the West, it will help you get easier placement there, and even you can get also further, you can do your PhD also, the same issue. Then I want to come back to your own achievements, pharmacy practice. Now you are already close to achieve your target, because pharmacy practice is equivalent to master of clinical pharmacy. So there is no way to come back again to look for the experience and something. The only thing you have to do is, Brother Abdul Qadir, you have to go for certification, and plus experience of minimum of 2 years. The certification plus the education background that you have, it will help you a lot to be a better candidate. I hope I answered my question.
Brother Azmi, do you want to ask a question? I can see that you have raised your hand.
Yes, I've raised my hand.
Yeah.
One more thing, brothers. One more thing. When you mean experience, the experience just count on the day after you get your certification.
I think
Experience is only counted after completing license registration. License registration. For example, let's make it clear. For example, in Sudan, there is two types of registration: temporary registration and permanent registration. So the experience will be counted after completing your permanent registration, that you are eligible to work as pharmacist. Experience 2 years after permanent registration.
yeah, I think that's clear. Yeah, Azmi,
If you don't,
that answer your question?
to add a point, if he didn't complete the 2 years experience, what is required in the Gulf countries is to complete the 2 years. For example, if the person did 1 year and a half in his home country and the remaining for him 6 months, required to complete the 6 months here. So getting 6 months experience here is not easy. The application process itself takes time. The chance of accepting you also it will take time, because there are many you can say expatriates born here, they prefer to do it here. So they don't want to back home their own country, because they are born, their families are here. So these people are in the queue list. So it may not be easy also to get, even though you will work freely, but it's also, it takes time from the application to getting for you a place to be trained. I hope it answers the question.
Another question? Well, I think we could finish here. And I would like to thank Brother Abdulghani and all our guests here. Hopefully you have benefited as much as we did. And it's been a pleasure to talk to you all. Brother Abdulghani, thank you very much. Hopefully we'll meet with you soon. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam, Brother Azadin. Allow me to thank all the attendees, particularly those who asked the questions, and the technical staff, Brother Jamal. And special thanks also goes to Ibrahim Awal Khair and Brother Azadin for helping me a lot to present this slide in this way. Thank you all. Thank you very much.
Thank you very much. Thank you, guys.